Okie dokie, we'll get started if that's okay. Hi everybody, great to see so many people on the call. Welcome to Community Mental Health Transformation webinar sessions. We're at the beginning of the next wave of webinars, which have all got a bit of a focus on our dedicated focus service areas. So we've got free sessions starting today. My name is Eloise Thompson. I'm Programme Manager for the Community Mental Health Transformation Programme, and I'll be chairing the session today, just really helping to glue together the stuff that you'll hear, and also just to keep us to time. I'm just going to start by running through some housekeeping, if that's okay. So the session will last about 50 minutes. That tends to be about 40 minutes for the presentation, with some time at the end for Q&As. The session is being recorded. I hope that's okay with everybody. If anybody does have any objections, could you please contact Janine Pounder. If Janine, you could please just put your contact details in the chat. If everybody could please ensure that your cameras are off and that you're muted. You've probably been automatically muted, but if not, if you wouldn't mind just putting your mute buttons on, just so we can ensure that we're focusing on the presentation. If there's anything that you wish to add or any thoughts that you'd like to give during the presentation, please feel free to add it into the chat. We'll make sure that we try and respond to that as the presentation's going along. If there's anything that we think that might be useful to bring back into the Q&A session, then we'll do that at the end. And we will share the slides with everybody following the session. Is that okay? Great. So today we're talking about adult eating disorders. As I mentioned earlier, this is one of our 3 dedicated focus service areas under the transformation programme. We're joined by Charlotte and Danielle. I don't know if you're there just to give us a wave.
Hello.
Thanks. I don't think I can see everybody on my page, but I can see yourself, Danielle. Thank you. So they're going to be taking us through all of the amazing work that's happening under the transformation. So if I could hand over to you, Charlotte and Daniel, just to introduce yourselves and take us through the session.
Lovely. Thank you, Eloise. So I'm Charlotte Long. I'm the service manager for the Adult Eating Disorders Service. Danny?
Hi everyone, I'm Danny. I'm the team manager of the Adult Eating Disorder Service. Quite new to post, so I started last month, but it's lovely to see so many people here today. Thank you.
It is. We have a presentation to go through, and as Eloise said, there'll be questions at the end, and Danny and myself are going to be going through the slides. So I think, Janine, are you sharing the slides for us? Oh yes, there they are. Thank you.
Yeah, so obviously me and Charlotte have just introduced ourselves, and we've just popped our email address there for the team. So if there is any queries or anything, if you please feel free to contact the team on the email there. Equally, you can also email myself or Charlotte as well. Thank you. Next slide, please. So just a little bit about who we are and what we do in our team. So generally the team's made up of psychology, nursing. We have both mental health nursing and physical health nursing in the team. Under the transformation, we have recruited some CBT practitioners who are currently going through their training, which we'll talk a little bit more about as we go through. We also have peer support worker, occupational therapy, dietetics, mental health and wellbeing practitioners, assistant practitioners, and our lovely admin team as well. So we provide assessment and treatment to people in Lincolnshire, either under our Tier 2 pathway, which is for people experiencing a mild to moderate eating disorder, or under our Tier 3 pathway, which would be the more kind of moderate to severe presentation. So that people might be experiencing symptoms of bulimia, anorexia, binge eating disorder, or it might be a kind of atypical presentation. So that might be another feeding or eating disorder. We don't currently work with people with ARFID, just helpful to note. And then very briefly, people in our team would be having a primary treatment. So that might be some kind of CBT treatment that's specific for eating disorders. So either CBT ED or CBT-T, which is a briefer form of CBT. We also offer mantra, group work, and more of a kind of structured clinical management as well. And I guess alongside that main treatment, we also then offer, this is where our other disciplines would be offering support. So that might be Beth, our senior peer support worker. It might be support from our occupational therapy or dietetics, who would work in a multidisciplinary team to support that patient with that package of care. Thank you. Next slide, please. So I guess this just kind of roughly shows where we work around the county. We are one team to cover, as we all know, quite a large county. So we tend to work across, Lincoln, Grantham, Boston, Skegness, Spalding. So we do a lot of travel in our team to make sure that we're seeing people as close to home as possible. Thank you. Next, please.
Okay, so just a little bit then about the transformation and how that looks for adult eating disorder services. So this is the Adult Eating Disorder Service Transformation Roadmap, which was designed really to bring us in line with the community mental health transformation and in line with national standards for eating disorder services as well. So the key themes, and these are going to be the themes that we're going to be talking about today, are that it's around providing specialist eating disorder support and treatment in a sort of step up, step down way across a pathway. So recognising that there's different levels of severity of eating disorders. Real key themes of early intervention, reducing barriers to access to service, embedding those experts by experience, not just in the delivery of the service, but also in the development and design of the service as well. We recognise the need for arrangements with primary care services when it comes to the medical monitoring. Obviously, we're a mental health service, but we very much have to work in line with both physical and mental health because of the nature of eating disorders. And we also recognise the need to work with children and young people's services to make sure that there's smooth transitions when they reach that age where they're starting to progress towards adult services as well. Have the next slide, please. So one of the key things that we had to look at is sort of how we adopted that tiered model for adult eating disorder services. So historically, and I'm going back as far as, I think it was around 2006 was when we first had specialised eating disorder services within Lincolnshire. And at that time it was an anorexia nervosa service, working with people with very low weights, very high physical health risk. Over the years, I'm pleased to say that we have widened the criteria for people with eating disorders and the support that's available within services for them. And so that tier 3 is something that has been there for quite some time. But what we wanted to do was to bring all steps of eating disorders and the service sort of under one umbrella. So if we look here, we have a tier model. So starting with tier 1, which is very much the subclinical eating disorders. So this might be where somebody's starting to have some difficulties with their eating or with their body image, for example, and it's looking at sort of where we can really get in early there, what support is available out there in the community without the need to come into a specialist eating disorder service, because at that level there's so many things that we can be doing at an early stage. So that's around working with community groups and voluntary care sector organisations, working with social prescribing with the university, and training and educating people to know what they are able to do at that stage is something that we're really focusing on. Tier 2 is the level 4 sort of, it's the pathway, sorry, the treatment pathway for mild to moderate eating disorders. So historically this was provided by IAPT services, so talking therapies services. So it didn't come under the specialist eating disorder service, but the clinicians were trained and expert in providing the treatment. But over the past year, we have gradually adopted that tier 2 from talking therapies and brought it under the umbrella of adult eating disorders services. And that involved a pilot study. We tested that out in the Lincoln area first. We chose Lincoln area because Lincoln University, so we'd get more referrals from the Lincoln area than we do from other areas. And what we found quite interestingly in the pilot phase is that the referral rates more than doubled, because in line with adopting that mild to moderate treatment pathway under adult eating disorders service, we also rolled out self-referral for that area during the pilot phase as well. And like I say, the referrals more than doubled. And that might be because referral rates are increasing anyway, but it could well be that it's around easier access and dedicated eating disorders services. We've now just adopted that tier 2 pathway from the beginning of March for the whole of Lincolnshire, and adopted that self-referral at the same time as well. So it's a little bit early to be sort of saying what the figures are doing there, but we are, we've got things in place and we're prepared to start providing treatment for people regardless of the severity of the eating disorder, with a real focus on early intervention. In tier 3, that's what is known as the existing service. So tier 3 is moderate to severe eating disorders, and I should say both tier 2 and tier 3, this is where we have the team that Danny described, really focusing on working with individuals. So not just the psychotherapy, but also the occupational therapy side of things, dietitian input, peer support worker input, a real sort of holistic approach to recovery from an eating disorder. We then have tier 4, which is generally it's inpatient. I've also mentioned there our Water Lily programme. So this is a programme that's run across the East Midlands. The best way to describe it is a 5-day per week online eating disorder day programme, and it's delivered by the Water Lily service, and we work closely with them with dedicated clinicians. We're just undergoing recruitment at the moment, dedicated clinicians for the Lincolnshire area. So that's something again that's quite new to the service, but we already have people who are attending that programme, and the idea is that it's there to either try and prevent admission to hospital or to promote earlier discharge from hospital. Our nearest specialist eating disorder unit is in Leicestershire, so that's our dedicated units. Unfortunately, sometimes people need to go further afield if there aren't any beds available. So we do work as hard as we can to try and keep people out of hospital, as long as it's safe to do so. We also work really closely with United Lincolnshire's Hospital Trust, so that we have coordinated pathways of care for when somebody needs a medical admission. We've recently recruited somebody called a MEAD practitioner, so you might notice the word MEAD, M-E-E-D, stands for Medical Emergencies in Eating Disorders. There are guidelines, and our MEAD practitioner is there to make sure that the guidelines are followed, to coordinate the care for that individual while they're in hospital, and to link in with clinicians at ULHT to make sure that they've got the understanding and the training that they need to help support that person. You'll see there's arrows there, that step up, step down, because the idea is that it should be about people being able to step up and step down between the different tiers as needed at any point in their journey. Okay, can I have the next slide, please? So I've talked about some of these things already. So we've developed that tier model. We've also very much developed our pathways around occupational therapy, dietetics and peer support work within the service. We've done significant recruitment to be able to work through the transformation. We were very lucky that we've been given funding to do so. Our clinical team has more than doubled in size. Danny spoke about how, you know, we've got new roles in the service now that weren't there before, such as CBT practitioners, our MEAD practitioner, our peer support worker, and occupational therapy that we didn't have before. Alongside that, our practitioners have been doing lots of training. So historically, there was very little specialist training for eating disorders out there, and I'm pleased to say that nationally that's really developed. NHS England has provided training for eating disorders practitioners, particularly around mental health wellbeing practitioner training and CBT, cognitive behavioural therapy training, and that's specific for eating disorders, so it's specially designed CBT for eating disorders. Alongside that, there are other national programmes of training that our clinicians have had opportunity to go on. So there's a treatment called Mantra, which is specially designed for anorexia nervosa. And there is something called Whole Teams training, which is more generic around eating disorders. I've already talked about the Water Lily Day programme. Something else that we're really working hard to do as part of the transformation is linking in with other services. So I think historically, we've probably worked in silo more and not linked in as well as we can with other services. So when I talk about other services, yes, I'm talking about other mental health services. So recognising that sometimes people have multiple needs, but also about linking in with those voluntary care sector organisations, with community groups, to look at how people can feel more supported within their community. Can I have the next slide, please?
Thank you. So something that I think we've done really, really well in the service and that we've been working on for a few years has been around in like having experts by experience involved in our service development and service delivery. So as Charlotte said, we have our senior peer support worker, Beth, who's well established in the team now. And we also have our service user involvement group that runs regularly throughout the year, and we also have smaller groups that come out of the involvement group that are more kind of project led. So we've been working on co-production of the Recovery College workshops, which I think we're getting there with now, and we're nearly kind of bringing together that piece of work. We have our experts by experience involved in recruitment. So I know when I had my interview for this job, I had part of my interview was with the experts by experience. We also have people who will go along and represent in the transformation to be part of that co-production and be part of the development. I guess something that we're really mindful of is not creating things on our own as a service and then asking for feedback, but kind of just making sure that from the offset that we have our involvement group along with us to help guide us in what they would like to see from our services as well. And as I said, the peer support worker Beth is really well established in the team. I guess in terms of next steps, we're really thinking about keeping this level of co-production up. So we're reviewing our website at the minute and thinking about how we might make it a bit more user-friendly, and having our experts by experience and involvement group support us and guide us with that as well. Next slide, please. So something that I know Charlotte mentioned earlier was around the barriers to access and making sure that our service is as accessible as possible. And something that, you know, people might have heard in the past has been, you know, there's a BMI cutoff or there's a BMI barrier in place that stops people accessing services, but that's not correct, and we don't work on a BMI basis. So I guess in response to the BMI barriers, we've adopted the mild to moderate pathway. So although we might ask for information around people's weight and BMI, it isn't an indicator of whether or not we will work with someone. Part of the transformation was kind of about people receiving that care and support as soon as possible. So we have developed our self-referral forms, which are now on the website, and I think we've got a link to them a little bit later on, but just to make sure that people are able to refer as soon as possible and to stop any barriers around accessing a GP appointment or whatever that might be. And we've also improved our training and education offer, so we offer our eating disorder forums throughout the year, and we're also going to talk a little bit more a bit later on about the other training offers that are available. We want to make sure that people have quick and that same access to care and support, whether it's the first time they're presenting with an eating disorder or whether it's a long-term condition, and that they would get that same level of care. I know kind of wider in the trust, we've been looking at transitions, and it's something that our service has also been looking at and thinking about how we make sure that people's care is transitioned smoothly and that it is timely. So we've been working with the CAMHS Eating Disorder Service on how we develop that, and it is one of our future aims to look at how we think about transitions from and to universities and other transitions that people often go through when they're receiving care with us. As Charlotte said, we want to make sure people are having treatment as close to home as possible, whether that be in an inpatient unit, and we're kind of working with Leicestershire to make sure it is as close to home, but we also work all around the county to facilitate that as well. And then in the trust, we know that we're really thinking about the no wrong door policy, so making sure that people are receiving the right care and treatment that they need, or if it is us as a service that are assessing but feel like they might kind of get the treatment that they need elsewhere, then making sure that we're facilitating that as well. Next slide, please. So something that has been embedded in the team for, I think it's probably about 3 or 4 years now, is it, Charlotte? Is the FREED model. So that's the first response early intervention to eating disorders pathway, and it's for people that are aged 16 to 25 and that have had symptoms of an eating disorder for less than 3 years. So the FREED pathway actually sits across both the children's eating disorders team and the adult eating disorders team, because of that age range. But that's something that is well established in the team, and that we're thinking about next steps with, because the national team for FREED has been disbanded recently, so we're kind of reviewing our service offer with this at the moment. And I'll just briefly mention about PEDS, which is about our training and education service, that kind of fit in with the FREED model to help promote early referral to service and helping other services identify the signs of eating disorders, but we will talk about that a little bit later. Next slide, please.
Okay, so one of those key aims was around the clear arrangements in place for physical health monitoring, particularly with primary care. I think historically it's something that we ask GPs to do the monitoring, and sometimes that might get done, sometimes that might not. So we've really worked hard to look at, and we're still working hard to look at, what's needed, and how it's done with regards to physical health monitoring. So already we've developed physical health monitoring pathways within adult eating disorders service. So we're responsible for doing that for people with moderate to severe eating disorders. So we do that with the support from our physical health practitioners and from a GP. Who's supporting us with that at the moment, and all of our clinicians have been trained up to do that monitoring in terms of the physical health observations that need to be done at each session. We've also provided some templates and guidance for primary care clinicians, so GPs, practice nurses, for example, so that's there on their clinical system, and it guides them for how to manage somebody's physical health with an eating disorder. So it has links to things like, for example, what blood tests that person might need, whether they need a referral to our service, or to the training and education links as well. The training and education service that is being provided has been offered to all primary care clinicians as well, and has been specially designed for primary care clinicians. We've already talked about the MEAD pathway development, but really it's about developing those good working links with the medical wards at the hospital, and about making sure that the guidelines for physical health monitoring and management are being followed. Next.
Thank you. I know I'd just started talking a little bit about transitions a couple of slides ago, but just to talk about it a little bit more. So we're really wanting to make sure that transitions for young people are holistic. So when people are coming into service at that age, kind of 16, 17, they do get the choice of what service they would like to be referred to, whether that be CAMHS, whether that be adult. And if someone has been working in CAMHS, you know, that get into that 17 and 3 months, 17 at 6 months, we're starting to think about having those conversations across our teams to think about transition for that young person and think about what it is that they would like from transitioning, what it is they would like from the service, and also making them aware of the differences in the service. You know, children's services and adult services can work a little bit differently. So starting that preparation work early and having meetings to slowly transition that person's care. We are going to be doing some ongoing work around embedding the transition tools into the team and the transition passports to make sure that they're being utilised by everyone in the team. And as I mentioned earlier, our next steps are to think about other transitions. So how we manage transitions when people are going to university or coming home from university, or to other teams as well. Next slide, please.
Yeah. I think in terms of the collaborative working, you know, we've already spoken about some of the things that we're doing. So, for example, the trying to develop the closer working links with community groups and voluntary care groups, the delivering of the mild to moderate pathway, and doing that. So I would say that that tier 2 mild to moderate pathway is very much a shared pathway with primary care. So we're really trying to get out there into those areas across the county, develop good working relationships with the primary care teams as well. We're also doing a lot of joint working with, and have been for some time, with other community mental health services. So that person can work in 2 services at one time where it's appropriate to do so. Or it might be around supporting our mental health colleagues if they're working with somebody who's got some eating difficulties alongside the other problems that they're working on at that time. We've been working also to develop joint working pathways with the Autism Diagnostic Service. So something we know is that there is a high rate of people, particularly with anorexia and a comorbid diagnosis of autism. And we know as well that waiting lists for autism are extremely long. So it's unfortunately, we don't have the means for people to jump the queue with assessments for autism, but it is about looking at how we can joint work with the Autism Diagnostic Service. So if somebody's under our service, it's what can we do to support them. We're having dedicated clinicians who are the champions for autism, so they'll be doing some training with the Autism Service. Equally, we'll be delivering some training for the Autism Service around eating disorders, just so we can get better joint understanding on that. We also work across the East Midlands Provider Collaborative, so that's basically a group of eating disorder services, so across Leicestershire, Lincolnshire, Northamptonshire, Nottinghamshire and Derbyshire. And so the experts, the specialists in eating disorders, so that includes experts by experience, but also, you know, consultants, clinicians who've worked with people with eating disorders for some time. It's about them getting together, sharing ideas for good working practices, and developments and transformation. So that's a really useful forum for us. We have over many years now worked closely with Lincoln University. We provide an advice clinic for students, and we also have a dedicated eating disorders in student support. We call it EDIS for short. That's a service that's provided within Lincoln University at the moment, and it's for students who are maybe struggling in that sort of subclinical stage of an eating disorder or eating difficulties. So it's about them getting the support early on. They're often the stage in their life where they're first time they've moved away from home. There can be a lot of stress. They've maybe not had to manage their own eating before. So the EDIS service is really useful, and they screen and they can signpost people to us if needed as well. We've already talked about the joint working with United Lincolnshire's Trust Hospitals. Next.
So a lot of the work we've been doing has really been around making sure the access to our service is easier. So with self-referral, we've had to, make sure that we're putting communications out there and liaising with other people to make sure that they're aware that we are now accepting self-referral and where to find the links and how to go about that. We're, linking in with those primary care teams and locality network groups to make them aware that there is the option now for people to do that self-referral. Once someone has done a self-referral, we have our duty workers that are available to screen those referrals and discuss them with other professionals. If it's another mental health team or GP that's referred in, we can have a consultation with them if needed. So we're doing that screening within 24 hours of getting that referral on a Monday to Friday, or we're signposting them to other services if there is someone else who might meet their needs a little bit better than our team can. And the training and education offered to primary care and other voluntary care sector groups regarding identification and referral for eating disorders. So more of that promotion and collaborative working again, as Charlotte was talking about. Next slide, please.
Yeah, and I'm also almost wondering if we should have put this slide earlier in the presentation. I can see somebody's asked a question about how do we access that sort of education and training service. So it's provided by PEDS. PEDS stands for Personalised Eating Disorder Support, and I've put the advert on here, and it's got the email contact of the people who arranged this. So PEDS are delivering this service for LPFT at the moment, so we do work closely with them and have worked with them to develop the training packages as well. So PEDS provide this offer to primary care teams, so for example GP surgeries, to mental health clinicians, to voluntary care sector hubs, to community groups, and to education. So if you're working with a group of people and you think that you may be liaising with people who might be struggling with an eating disorder, or you want to know about how to identify an eating disorder and what to do, then this would be a really useful course. So the courses are designed for whoever it's being delivered to. So for example, it might be slightly different for people in education than what it would be for the GP. For the GP surgeries, for example, it might be around a little bit more focus on the medical monitoring. But this is, I should say, this is a free education and training service that is available to us. We've got funding till the end of March 2026. So like I say, the contact details are on there. So I really do encourage people that if you're interested, want to know more, please do get in touch with them about this. Next. We've also referred to the eating disorders in student support that's available at Lincoln University. There are talks at the moment about the potential for that to expand to the other university in Lincolnshire, which is the Bishop Grotesque University. I think they're changing the name. I can't remember what to at the moment, but yeah, so that's something that is there, and that's for anybody who's a student at Lincoln University can access that. And I have put the link on there as well, so people can self-refer but to that service if they're a university student at Lincoln at the moment. If somebody wanted any support in accessing that or just wanted to know a bit more, by all means contact myself or Danny and we can talk a bit more with you about that. Next. Just very quickly, sort of some of the challenges that we've had with the transformation. We didn't want to sort of discount this at all, really, is that, you know, it has been a period of significant change, particularly over the last, I would say the last 2 or 3 years. It's changed significantly from a service that worked with a sort of smaller group of people with fewer clinicians and very little specialist training, although a lot of experience, I should say that, into a service where, you know, we've had some really exciting opportunities, but then with change as well, that can always sort of pose some challenges. And it is about people sort of adapting to that. And I think, you know, the training and the recruitment means that we have got a team that we've still got a sort of core group of people who've got a lot of experience within the service, but we have got a growing team of people with less experience as well. So that's taken up a little bit more time, you know, time that they've needed to attend their university courses, to attend the extra supervision that they've needed at this time. We've had some challenges with recruitment. There are some posts that's not specific to Lincolnshire that we have struggled with recruiting a consultant psychiatrist who's specialist in eating disorders and a more senior psychologist. And we've had vacant posts for some time now for those. We are developing shared clinical systems with GPs because looking at sharing of information at the moment, we're all on different clinical systems. So particularly as we're improving those working links and sharing that care within the mild to moderate tier 2 pathway, we have identified that we need a shared way of sharing information and a clinical system to do that. So that's being developed at the moment. We've talked about the physical health monitoring and how we're needing to look at what the demand is and what resources we need to have in place for that, particularly again for that mild to moderate pathway for eating disorders. We're pretty much there for the moderate to severe eating disorders. Yeah. And again, reflecting, sorry, Danny, go on.
It's all right. I was just going to say about the increase in referrals that we've been seeing. And I think especially over the last couple of years, especially since the COVID pandemic, we've really seen that people are coming to services often more poorly and more that high level of acuity where sometimes they're needing physical health admissions quite quickly after coming into the service. And so those are challenges that definitely add to the picture of, you know, when we've got a team that are doing a lot of training and it is being a different kind of demand on the service.
Thank you. Next. I'm aware of the time and I think this is our sort of pretty much our last slide. There's just another one for some information, but where are we focusing next? We're really looking at strengthening that sort of all age pathway for eating disorders, and I think we're doing that well already, because we're working closely with the CAMHS eating disorder service, but making that as smooth as possible for the people we're working with. We're looking at what's needed for an ARFID pathway. Danny mentioned ARFID earlier. For those of you who aren't aware what ARFID is, it's avoidant and restrictive food intake disorder, previously known as picky eating, but it's starting to nationally be more talked about, be more recognised as a kind of eating disorder. It's very different from other types of eating disorder. So we're starting to have discussions with commissioners around what's needed for that ARFID pathway. I think some of the other things we have talked about, we are still recruiting. We need to make sure, we need to really focus on equality and whether we're reaching the whole county and the different demographic of people. Are there any areas that we're missing? So that's going to be one of the next focuses for us. We offer waiting list support because we do have a small treatment waiting list. I say small because although it's much longer than we'd like, it's around 16 weeks at the moment. For some people, that's about the maximum. We do offer support whilst people are waiting. Compared to the national average, that is quite a short waiting list. And we're continuing to really sort of embed those clinicians into the primary care teams. I think next is just some information that we thought would be useful to share with you, which is our website link and our self-referral link. And then I think that's it. Thank you for listening, and keen to see any questions.
That's brilliant. Thanks ever so much, Charlotte and Danielle. Really, really informative session, and I think just really, really helpful to hear about all of the different interventions and support that's available. Just going to open the floor to any questions. There is one in the chat, guys. I don't know if you saw it. So there's one that says, can individuals self-refer to the Water Lily programme, or does this have to go through a professional?
It has to go through a professional. It does. It has to be done. Unfortunately, it's the same as an inpatient specialist eating disorder referral for an inpatient bed. It's the same. It has to go through our service for Lincolnshire.
It's almost kind of like tier 3.5, so to speak, kind of sat between our service and tier 4 service. It's just a little bit of a step up, so they would still need to be held by a community eating disorders team to access that.
Brilliant, thanks guys. Someone just asked to share the last slide again. Claire, just to let you know, we will be sending out all of the slides following the webinar, so you'll be able to catch those links and actually be able to access it. I've just tried the links actually myself and just had a little look on the pages that sit behind them, so they will be sent out to everybody who's attended the webinar, so you will get those. A question from Rachel, guys. Roughly how many referrals do you receive into each tier each year? That's a rhyme.
That's a really good question. I just saw that and I thought, oh, I don't know. So I've just had a quick look. So for the tier 2, the mild to moderate pathway, it's really difficult yet for us to know. So I can give you a figure for that. So in 2023, when Talking Therapies worked with the mild to moderate pathway, they had 35 referrals for people with eating disorders for the whole year. That's for the whole of Lincolnshire. Now, when we rolled out just to 3 PCN areas in Lincoln the following year, so for the year that we did it in the pilot, we had 83 referrals for the year. So that's not even for the whole of Lincolnshire, and we had more than double. So that gives you a sort of idea for the mild to moderate. So I'm expecting that this year it's going to be even more, but I don't know how much it'll jump by. So in a year's time, we should have a more accurate figure there. In terms of the moderate to severe pathway, I should know, and I don't know. I can find out for you, Rachel, if that's okay, if I can let you know. I would say on average, we can get between 3 and 7 referrals in a day. It can vary so much from day to day. And around 20-25% of the referrals we get in, we're supporting with signposting. It might be that it's come to us and actually it's another mental health service that's better suited to meet that individual's needs. But sort of that's the sort of level, and then we will assess the people that we think, you know, yes, we're the right service for them.
Thanks, Charlotte. Any other questions from anybody else? I've got a couple, but
we're still in the chat, Ella. There's one from
is there a new one? Sorry,
Anna
it's
that
this
says,
new.
it's okay, I can do it. It's okay.
Thanks, Laura.
It says, are you able to support individuals who may have developed an eating disorder as a result of cancer treatment? Thinking about head and neck cancer thinking about head and neck cancer patients who have undergone radiotherapy treatment in particular.
Yeah, absolutely. You know, as long as there's the drivers that we would look for in an eating disorder, so that it's been driven by weight and shape concerns, it doesn't really matter why, you know, what the cause of developing it was, that wouldn't make a difference to whether we would work with someone or not, but just that those drivers are there for it being like a diagnosable eating disorder. But yeah, we would.
Whereas if those difficulties were there because of purely because of physical health issues and not because of psychological, then that wouldn't be what's sort of under the classed as an eating disorder. That would be around physical health support that would be needed for eating. I don't know if that helps.
Thank you. Sorry, Laura, my chat's updated. No, I appreciate it. I
want me to do the next one while yours is updating?
I've got the next one now. I think it just hadn't updated. I keep going up and down the list, and they're dropping in. So just been asked if you could speak a little bit more about the Water Lily offer, if that's okay, please.
Yeah, absolutely. So Water Lily, like I say, it's an online day program, runs over 5 days per week, and so it's throughout the whole day. So it's almost a bit like a school day in some ways, although that probably isn't selling it very well. But different sort of lessons or sessions throughout the day. So some of it might be around psychoeducation around eating disorders, or it might be around a CBT group that then people would go into. But there is time also for eating online with support. So having snacks together. And again, it's online. So the person has to be quite sort of motivated in a place that with a lot of support, it's a lot of online support, but they're prepared to put themselves through the changes they need to make with their eating. But they'd have lunch together as well. But as well, the programme does offer some one-to-one support. So there's time throughout the week where, for example, they might go out to a cafe to do some social eating. It would be agreed goals with the individual, or it might be around looking at developing quality of life in an area. So, you know, looking at sort of what they might be able to do sort of outside of the eating disorder. So there is support from an MDT, so occupational therapy on it, but also dietitians might come and do some sessions on nutrition as well. Might be a goal setting group. And it's a 12-week program. And then after that, if people want, they can do sort of a reduced sort of step down from Water Lily, because it might be a lot to go from 5 days a week to, I say, nothing, or one hour a week with one of our clinicians. It would be around sort of, you know, they could do a sort of a gradual reduction. So they're getting sort of a check-in a couple of times a week. But they still, even though Water Lily, it's sort of it's a service that sort of, it sits there on its own, but it covers the whole of the East Midlands. But we have clinicians who also sit within our service that provide Water Lily. So they're linking in extremely closely with us, and somebody would still be seen by one of our clinicians whilst they're also doing Water Lily. Have I missed anything, Danny? No.
Don't think so.
Great, thank you. Any other questions or thoughts from anybody? Oh, hold on, I think another one's come in. Oh no, that's Laura just updating around how are you Lincolnshire, so people can access all of the webinars and previous recordings. Just I suppose just perhaps a thought and a question from myself, if that's okay. So I suppose one thing I was really interested when you talked about some of the next steps was hearing about the work that you're doing to look into if there's any barriers to access, or if there's any cohorts of people or any areas across the county that might not be accessing services. So that was one of the things that went through my mind really, with all of the new interventions that are being offered. Are people accessing services? Is there anywhere where people aren't aware or getting the support that they need? And I guess probably some of it is demonstrated in those numbers that you described around that, the increase that you've seen through just that pilot piece of work that you've done. So that that's quite a significant increase, isn't it, in terms of people that are actually accessing that intervention. The other bit I was just interested in was what the uptake of PEDS, if I said PEDS is that the right way of saying it?
It is, yeah. There's been a really good uptake, actually. A fantastic. I had the figures in front of me earlier for a report that I'm doing, actually, and I think I want to say it is, where is it? I've got the figures in front of me. There's a really good uptake, particularly from education services. So far, they started delivering the training sort of January, February time. They've trained 535 people over 77 sessions. So there's a lot of demand for it, and they've still got a lot of other inquiries that they're booking in. And there's really good feedback from it as well. You know, people are saying they found it really useful. I've just seen one more question, Eloise.
Yes.
Yeah, what kind of support is there for binge eating disorder? Yes, there is. So with the adoption of the mild to moderate tier 2 pathway, we've now been able to start working with binge eating disorder across the whole of Lincolnshire. So for that pilot area since last February, but for the whole of Lincolnshire since the beginning of March. This is fantastic because there's very much a need. So we offer either binge eating disorder groups, which sort of is CBT in the way that it works. But if somebody can't do a group for any reason, we can offer some one-to-one interventions there. So that's still really quite early for us, but we are now providing that and accepting referrals. So that's great.
Brilliant. Thanks, Charlotte. Any other thoughts or questions? Just giving it a couple of minutes for it to update on my Teams. I don't know whether it's my internet that's taken a few moments to catch up. It looks like that might be all the questions. Thank you so much, Charlotte and Danielle. Really, really appreciate you being with us today to talk about all of the amazing work that you're doing. Thank you ever so much to everybody who's joined the session and taken out the time to learn about the work that's happening around eating disorders. As I mentioned, all of the slides will be sent out afterwards, because I think there's also quite a lot of information to take in as well, so I think it will be useful for people to be able to have a look at those. The next session that we have planned is on the 10th of June, and that one will be around our community rehabilitation service, so hopefully people will be able to join us for that as well. Thanks ever so much, everybody. Hope you all have a lovely afternoon. Take care.
Thank you. Bye.
Thank you.